Welcome to Cork University Hospital. This is an information video about cerebral angiograms. On the day of the procedure, you will enter the hospital via the main entrance. Next, you'll pass reception on your left and continue down a long straight corridor. You should arrive fasting, and you should have somebody to collect you after the procedure is finished. The radiology department is located on the ground floor. You can either take the lift down one floor or take the stairs as shown. Some patients are admitted directly to the radiology department, whereas others are admitted to the surgical day ward, which can be found directly behind the lifts. If you are being admitted directly to the radiology department, simply follow the corridor until you see the sign for X-ray. Check in with reception upon your arrival. Once you've checked in, you'll be directed down to the holding bay, which can be found just down the corridor and on your left. Here, you'll meet the nurses that will be looking after you for the day.
Hello, I'm Sheila. I'm an interventional radiology nurse. Welcome to X-ray. You'll be meeting me or one of my colleagues while you're here.
We will check your details, perform a clinical assessment. We will ask you to change into a hospital gown, remove any jewellery and hair pieces, and we may put a little plastic tube called a cannula into a vein in your arm. We will be using radiation in the form of X-rays during the procedure. If you are of childbearing age, you will be asked to complete a form to confirm that you are not pregnant. Once the pre-procedure checks are completed, you will then meet our interventional neuroradiology consultant, who will go through the procedure, answer any of your questions, and will ask you to sign a consent form stating that you understand what procedures you are about to undergo.
After the procedure, you will meet me or one of my colleagues back here.
Hello, I am one of the neurointerventional radiology consultants here. On the day of your procedure, me or one of my colleagues will be performing your angiogram. A cerebral angiogram is a diagnostic procedure that uses X-rays and X-ray dye, known as a contrast medium, to assess the blood vessels in your brain. If this is your first angiogram, the information we get from this test allows us to identify any problems with your blood vessels and can help us plan further treatment if it is required. If you had a vessel problem treated in the past, such as an aneurysm, this test may be performed to check that the treatment was successful. To get access to the blood vessels to inject the X-ray dye, we may use the artery in your groin, called the femoral artery, or the artery in your wrist, known as the radial artery. The procedure is usually performed with you awake using local anaesthetic, which involves injecting some numbing medication under the skin. This can sting for a few seconds, similar to the sensation you experience at a dentist. Once the area becomes anaesthetised or numb, you may know that we are there, but you should have no pain. Once we access the blood vessel, we place a small plastic device called a sheath, and through this we pass another longer tube called a catheter, which we navigate into the blood vessels going to your head, parking it in the neck. Occasionally, and understandably, patients can be anxious, and in such cases we may administer sedation. Although a straightforward procedure, there are some risks that you should be aware of. At the site where we enter the blood vessel in your groin or wrist, there is a small risk of bleeding, or a collection of blood called a hematoma. Extremely rarely, the blood vessel could be damaged, which would cause a blister on the vessel called a pseudoaneurysm, or could impair the blood supply to your hand or leg, but this is very rare. The X-ray dye can cause an allergic reaction in some people, again this is uncommon. More specific to the angiogram portion involving the vessels going to your brain, there is a small risk of causing a stroke, which is a very broad term, encompassing transient neurological events, all the way to a weakness on one side of your body or the inability to speak, for example. However, the risk of this is very small, at about 1 in 200, and be reassured that although there are risks, and they are small, we do everything we can during the procedure to keep these to an absolute minimum. Moreover, we would not recommend this test to you unless we thought that the benefits were far greater than any potential associated risk. So now we're ready to take some pictures of the blood vessels in your head, which our specialist radiographers will now take you through.
Hello, I'm Damon. I'm one of the radiographers here in the IR team in CUH Radiology. My role in your procedure is to operate and control the X-ray equipment. We will carefully manoeuvre the equipment around you for the optimal imaging of your anatomy and blood vessels. During the procedure, you will be aware that our X-ray equipment is moving around you, and at times the equipment may come in closer for certain images, but nothing will come in contact with you, so please try to stay as relaxed and still as you can during this time. By doing this, you will be helping us get the best images we can for you. The start of any procedure can seem quite a busy time. Please try not to worry about this. It is a normal part of the process. As radiographers, we will be with you from the start to the finish of the procedure, and we'll do everything we can to keep you comfortable and informed. During the procedure, we will be closely monitoring the positioning and quality of your images. As such, you may hear some technical discussions between the radiographer and the radiologist regarding this. Please do not be concerned if you do hear technical conversation during your procedure, as this is normal and this communication is how we maintain the best standards we can for our patients.
Once we have taken all the pictures, we will take the little tube out of the blood vessel in your groin or wrist. For the groin, to stop the bleeding, we may put a little stitch into the blood vessel, or more commonly, we will just press over the area for about 10 minutes. For the next 2 to 4 hours, you will be lying flat, keeping your right leg straight. If your procedure was done using the vessel in your wrist, then we will apply a small compression device to prevent bleeding. This remains in place for about 1 hour. During this time, our fantastic nurses will be taking excellent care of you, which they will now take you through.
After the procedure, you will be brought back here to recovery on your bed.
For the next 1 to 4 hours, I will be checking your heart rate, blood pressure, oxygen saturation, and will be regularly assessing the puncture site for any bleeding. If you have any discomfort, we could give you some pain relief. You can eat and drink when you are up to it. On discharge, you are not allowed to drive for 24 hours. You must avoid any strenuous activities for 48 hours. We advise that you keep the puncture site dry for 24 hours. We will place a little dressing over the site which can be removed after 24 hours.
You may have some bruising after the procedure. If you have any bleeding, lie down, put some pressure on the area, and go to your nearest accident and emergency.
I hope that this information has helped to reduce some of the fear and anxiety surrounding your upcoming procedure. Remember that after you leave the hospital, if you have any concerns, a member of our team can always be contacted at the following numbers. Thank you for choosing Cork University Hospital.